There's a combination of things that makes a good doctor. I think it's dedication, empathy, obviously knowledge, and most importantly, care for your patient. It has to be equally important for you to treat and cure this patient as it is for a parent. When they say, I would treat my child this way. When I was little, when they talk about that why phase, like, why does this happen? Why is this way? My mom used to say that lasted forever. And I felt like science kind of answered all those questions. When I was going through medical school, you go through different rotations. And when I was in pediatrics, I felt like I was making a difference. They're pretty resilient. They would get better and they would just wave you out the door when they had already been a couple of weeks hospitalized. I felt that was the path for me. I first felt interested in hematology oncology when I started going through residency. I had one of the electives. And then I started to see the difference you make. Hematology and oncology, it's kind of like an ever-evolving field. Every certain amount of time, we get more and more treatment options. In our field, we treat both hematology and oncology, which, they're pretty separate fields. In the terms of hematology, it's anemia to sickle cell anemia, which is like a lifelong disease. We also have bleeding disorders. So everything kind of blood related. And then we also treat the oncology side of it, which is cancer, non-malignant, obviously malignant as well. The most common of which is leukemia. We also treat brain tumors, neuroblastomas. I think oncology is like a team-wise approach. The patient comes in, it's going through this difficult time, and you want to make them feel comfortable, but also the parents feel comfortable. I also tell them, it's a journey. Let's take this stepwise approach. So this first month, this is what's going to happen, right? And then once we're done with this first month, let's take the second month. And then every time they're like, okay, we're okay, we can continue on this. And then they're able to feel more and more comfortable. My favorite part of my job is actually when they ring the bell and finish treatment and we can say you're cancer free.